I'm Eugene Braunwald, and I'm a cardiologist at the Harvard Medical School and at the Brigham and Women's Hospital. And I'm here to tell you something about a compendium of papers which are being published in Circulation Research. And the subject is the cardiomyopathies. Now, the cardiomyopathies have been a sort of stepchild in cardiology, because the other known types of cardiovascular disorders are congenital heart disease, valvular heart disease, congestive heart failure, hypertensive heart disease, and all the ones that are familiar to you. Cardiomyopathy has been sort of in the corner, and it's been really occurs because there have been the number of patients with any single cardiomyopathy is modest. It doesn't come close to those that I've mentioned. Doesn't come close to coronary disease. But when you put them all together, then the cardiomyopathies form a significant number of instances. The prevalence, when all of them are placed together, is quite large. Now, what has happened in the past few years is there has been an explosion of new information about cardiomyopathies, and that's what we're trying to capture in this compendium. My colleague is Dr. Ali Marian of Baylor College of Medicine, and the two principal areas where progress has been made has been in genetics and in imaging. That's where the frontiers lie. Increasingly, we see that cardiomyopathies are inherited. Some are inherited with several genes being involved, others a huge number of genes, but the genetic component of cardiomyopathy is very powerful, and I think we're getting to the point where genetic testing is becoming an important diagnostic technique, at least for one of the cardiomyopathies, hypertrophic cardiomyopathy, and the others are falling close behind, particularly right ventricular dysplasia. The other area where tremendous progress has been made has been in imaging, and new forms of imaging, the application of new technology to echocardiography, for example, is very important. Using speckle tracing, it's now possible to define a condition that's called strain, myocardial strain, in which there is movement of specific spots on the myocardium, and you can see early changes that foretells the future development of an overt cardiomyopathy. The other particularly important imaging area is some of the advances in magnetic resonance imaging, which show both anatomic and perfusion abnormalities. They show, for example, in cardiomyopathies, interstitial fibrosis, an increase in extracellular connective tissue, which is a prominent part of several cardiomyopathies. And I think that early MRI is predictive. Now, therapy has also come a long way, although it is clearly behind the basic sciences here. I think that there are many patients with cardiomyopathy who are at risk of sudden cardiac death due to ventricular fibrillation. And of course, once that risk is defined, this can be prevented with the implantation of an implanted cardioverter defibrillator. And I think that has saved many lives. I think other techniques for cardiomyopathies in some instances includes surgical septal myomectomies. That's an invasive procedure, of course, the surgical procedure, but also in the cardiac catheterization lab there are interventions of blocking the septal artery in hypertrophic cardiomyopathy patients where the septum is greatly enlarged and is responsible for obstruction. So it's a large field. There's a lot of new information in it, and our goal with this is to stimulate people, is to bring them up to speed. The readers of circulation research are largely scientists, but they're cardiovascular scientists, and they want cardiovascular medicine to improve. But this will bring them up to date. It's also read by many clinical cardiologists, and clinical cardiologists should understand the basic science behind the conditions that they treat every day. So we hope that this compendium will be found useful. Certainly, it's been a very educational experience for me, and I hope it'll be an educational experience for our readers. Thank you.